Hi from Mental Health Learning. My name is Alice Newton-Leeming, and today I'm here to talk to you about how to look out for signs of mental health concerns amongst staff who are working remotely, and also how to provide the appropriate kind of support for them, given that we are no longer able to have social contact with each other at this present moment in time. So, as we know, the government's advice regarding social isolation means that most of us are now working from home. So, looking out for signs of mental ill health amongst your members of staff probably feels like a really tricky thing to do right now, given that we aren't regularly seeing each other. One of the things that helps people feel good about their job is the people that they work with, and that's now been taken away from them. So, maintaining contact with those that you work with and manage on a regular basis and creating opportunities for them to still work with their colleagues in alternative ways is now really, really important. So, given the challenges that we are now all facing and the anxiety and fear that has been expressed by many people relating to the coronavirus and the knock on effect that it has had on our working and social lives, the financial implications that it's had for some individuals, and the overall uncertainty around what is still to come, means as managers we need to be creating opportunities for staff to talk about how they are feeling more than ever. As an individual, you may also be feeling lots of these things as well. And as a manager, it's really important that you also take the time to talk to someone about how you feel, because it's essential that any worries that you have aren't bottled up and expressed to those you manage in other ways, such as frustration or snappy emails and things like that. It's really important that you be open, be vulnerable, and show that you can relate to what those you manage are going through as well when you are checking in with them, rather than putting on a "I'm fine" face. Now is the time more than ever to put their mental well-being at the forefront of your communications. So your best skill and quality right now is to be empathetic and understanding about the situation. So at Mental Health Learning, we have put together a guide to help you consider basically how you might do this online or over the phone. In summary, it is about firstly creating regular opportunities for face-to-face interaction online or over the phone. So by enabling team meetings to still go ahead, having regular one-to-one check-ins as well as supervision for staff to simply talk about how they're experiencing the current situation. Secondly, it's about being on the lookout specifically for anything that could be a mental health concern. And you can do this over the screen or over the phone, or even in emails as well. So looking out for perhaps irritability or short, snappy emails or responses. Members of staff who just aren't present when you create those opportunities for members of staff to contact each other. Members of staff that simply aren't staying in touch, or members of staff that simply express their hopelessness about the situation and have fluctuations in their mood. When you are concerned, it's really important that you don't sit on that and you need to act immediately. Okay, so inquire as to how they are with open questions, listen to any feelings that they share, and accept those feelings that they share with you. If they feel a sense of loss, feel hopeless, and share that they are experiencing pain with you, then it's really important that you ask about suicide as well. This is the worst that it could get, and asking will show just how seriously you take their thoughts and feelings. See our separate guide for responding to thoughts of suicide, and we also have a suicide safety plan that you could also share with them for them to put things in place in order to help them stay safe from acting on those thoughts of suicide. Finally, create an action plan with the member of staff. Encourage them to share how they are feeling with others at home, and also share details with them of formal supports that they could be in touch with. Discuss their current workload and their responsibilities. Are there things that can be adapted, or do they need to be adjusted given the current circumstances? And agree a regular check-in with them so they can talk to you about how they are finding everything. So we're going to be uploading more videos to help you support your staff in the next few weeks whilst they are working remotely. So keep an eye out on the Mental Health Learning YouTube page or my LinkedIn page, Alice Newton Leeming.